everybody. This is Jason Eagle, your natural health authority, with another today's podcast, Healing Matters. And today we're going to talk about massage. We're going to talk about massage therapy. Everybody, that is, if you have a body, if you're listening to me, you got ears, you got a body, and that even includes animal bodies and other beings. Every body works on a level of, it breathes, it has blood, it has lymphatic tissue, it has lymphatic fluid, it has an immune system, it has a nervous system. So, again, this is Jason Eagle, your natural health authority. You can subscribe on my YouTube channel. YouTube channel is Jason Eagle QRA-LMT, which stands for Licensed Massage Therapist. QRA stands for Quantum Reflex Analysis Practitioner. Those are my call letters in terms of that's what I do. My Facebook is Strategic Healing. So anyways, we're going to talk about massage therapy. That's how I got started. That's still what I am. I am a licensed massage therapist, and that means I'm licensed by a state body. I am also nationally certified. National certification means I actually had to pass a board. I had to pass tests. I had to go through school. I had to go through clinicals. The whole shebang, which is similar to medical school, but not as long, not as big, and not as intensive. But I had to learn all my anatomy. I've also done a lot of extra work in terms of done cadaver work, which is also common for anyone in medical school. You have to do cadaver work, which is you have to cut open human bodies. You have to look at what they look like and be tested on that. And so I've done that, and I've been doing massage therapy for over 25 years, and that's been my career. Why do I say everybody? Because everybody has a body, and massage therapy is something that can help everybody. It's touch, and that's one of the big things that we are starved of in this culture is touch. Touch has become taboo, and you don't want people touching you unless they are a family member, and some people even that. Some people feel like they don't want someone touching them unless it's an intimate. Some people think that touch means intimacy, whether it be sexual or something like that. I am a clinical massage therapist, or what's also known as a medical massage therapist, which is clinical settings, meaning like a clinic, and it's more like medical. And my specialties are in deep tissue work, also what's known as structural integration work. Basically, I can put your body back together. A chiropractor works on the joints. I work on the joints and the connective tissue, the tissue that connects all of this. That's not just your muscles. The most abundant tissue is what's called the connective tissue, or the fascial, or the fascia. What is the best way to set up an appointment for massage therapy? You can go to my website. So my website is strategichealing.us. And if you look at the top button, you will see at the very top, it says schedule. And you'll notice that it says medical massage. You can do, or medical sports massage. And I'll talk a little bit about what these things mean. You can do a half an hour. You can do 15 minutes. You can do an hour. You can do 2 hours, hour and a half, 2 hours. Sometimes people do that, and sometimes that's what it takes. So, but let me describe a little bit all of the different forms of massage therapy. Let's talk about the history of massage therapy. Massage therapy has been around forever, ever. It has been the first thing that people have done with other people, which is touch. We do it on ourselves. You stub your toe, you touch your foot, and you massage it. You have a sore shoulder. It's innate. We do this. It's part of what the immune system does. It's also part of what the nervous system does. It relieves pain. It causes the body to release hormones, healing hormones. It reduces the negative hormones in terms of the inflammation, the things that cause disease, the things that also cause pain and discomfort. It moves lymphatic fluid. Again, when you go back in history, and many, so one of the top doctors here in United States is you can be an MD, which is called a medical doctor, but you can also be what's called a DO, which is actually extra schooling. You actually not only have to become an MD, but you have to go more and learn how to touch people, learn how to manipulate. DO stands for osteopathic manipulation. Similar to a bone, osteo means bone, but it's really the whole tissue. It's everything. They have to learn how to touch your body. You go to other places in the world, like for instance, if you are in China, and you are a Chinese medical doctor, not only do you have to go to standard MD medical school, but you also have to learn massage. You also have to learn acupuncture. You also have to learn diet. You have to learn herbs. You have to learn, because it's a whole thing. But again, and then you go in other parts of the world, there's the Turkish massage, there's the Swedish massage. Every culture has their form of massage. And American massage is a blending of all of these different things. And I have been certified in all of my certifications in terms of what I do as far as what my expertise is. It's a list as long as your arm in terms of all the different forms, from light to deep to specific on the specific tissues to basically specific movements. So when you're talking about medical massage or sports massage, the reason they call it sports massage, it's not just for people who do sports. The reason that sports massage is that kind of designation is because it also involves a lot of stretching. It also involves a lot of target. You can go to a fluffy buffy place and just get a whole body type of massage, which uses oils and it's very smooth and it's very nice, which has a benefit too. I don't want to poo-poo that, because even just a nice relaxing massage which makes you feel good, is very powerful because it releases these healing hormones. It stimulates your nervous system to heal, to reset. It calms your nervous system. It increases what's called the parasympathetic. There's the sympathetic nervous system, that's the fight or flight, that's survival. And then there is the parasympathetic, that is the healing, that is the calm, that is the release of the happy hormones. And so even a light Swedish Swedish massage, which is not deep tissue, is also very beneficial. Everyone has their preferences, but medical massage or deep tissue sports massage, I'll have people that will come in and say, I've got a bad shoulder, and I'll spend that whole hour on their shoulder. I got a bad ankle, I'll spend their whole hour on that area. Now I also connect to, because the shoulder is the neck, the shoulder is also the hip, and so I will also work on other places. A lot of times, when you're getting work on one shoulder, you're going to get work on the opposite hip, because there's what's called a cross syndrome. When people get massage and when you're pressing on their feet, they go, oh my God, I feel that in my head. Am I crazy? And we'll say it's all connected. And that's kind of, a very easy way of saying why you feel that. But it's true, literally, it's true. Everything is all connected, literally, by the fascia, the connective tissue. If you look at your body below your last layer of skin, so if you peeled your skin off, you would look like your body is dipped in wax. That's what's called the superficial fascia. So like a bridge, if you pull on one side of the bridge, one of the cables, so think about, like, for instance, like the Mackinac Bridge. It's a suspension bridge where you have these two towers, but you have these guy wires, these cables that go up and then from one side to another. If you pull on one, it's going to pull on the one all the way. So if you're pulling on the one that would be the head, you're going to see it move at the feet because they're connected. Like a garment, for instance, think about your connective tissue like a shirt, or like, say, long john pajamas. If you pull on the collar, you're going to notice that you're going to feel it. You're going to see the lines of tension go all the way down to the footies, right? Because it's all connected. So what's called the superficial fascia and what is fascia? When you've cut meat before, it's that thick white fibrous stuff, which would be called sinew. Now, connective tissue also has other names, which is, it all blends together, and depending upon where it's connected, it has different names. although it's all connective tissue, it's all made out of the same thing, and it all has, like I said, connections to each other because it's all literally connected. Now, one of the names would be a tendon. A tendon is connective tissue fascia that connects a muscle to a bone. Then there's ligaments, and ligaments are the connective tissue of a bone to a bone. So we have what's called the superficial fascia, which is on the outside. Then we have muscles that are also underneath. Now, every muscle is individually saran wrapped like the skin on a hot dog. So if you think about like a muscle, like say for instance, like your bicep muscle, the one in your arm, if you were to look at that bicep muscle, it is surrounded by this connective tissue, and then at the ends, that connective tissue, like when you twist off a hot dog, the skin on a hot dog, right, or the membrane on a hot dog, the meat's on the inside, that would be the muscle, the outside it's wrapped in this stuff, and then it's twisted. Where it's twisted is that's where it then connects to the bones. Now, every muscle is individually saran wrapped in its own layer of connective tissue, which is connected to the superficial fascia, so it's all connected. Every organ, so your heart, your lungs, your kidneys, every single organ is also connected in a bag of this, it's what's called the pericardium, but every organ is connected in this fascial layer, which is connected to all the muscles, and every bone is individually connected. So basically, every part of your tissue is like a hot dog in the sense that it all has the hot dog skin, right? Which is all then connected to each other. And so that's why people can say, I feel it here, and it's all connected. So that's why too, when a lot of times when you're working on a person, especially with what's called structural integration, a person goes, I've got a kink in my neck and it's on the right side of my neck. Can you feel that big bulge right there? I want you to work on that. And then I will work on that, and then I'll go down to, let's say, their calf. They're way down at the bottom of their leg, and they go, why are you working there? I work, and they go, oh, well, that's why you're working there. Because a lot of times, think about it. You could have, for instance, a tight muscle in your calf, in your, let's say, your ankle, okay? The muscle in your calf, which is that's that back muscle on the back of your leg, the lower leg below your knee. If that is all tight, then it's going to affect the way you walk, and you're going to walk with a slight limp, right? You don't see it, but if I walk behind it, like I'm out in the world and I'm analyzing everybody. I can see everything in everybody. I can see fallen arches. I can see this thing. So let's just think about this way. You have a little bit of a limp. You don't walk equally. Over time, what will happen is you'll see that that shoulder elevates, and then that shoulder becomes all kinked up and stuck. So many times, where did it start? Now, we like to say it starts with the foundation. That's why I spend a lot of time looking at the feet, looking at the arch muscles, looking at the bones. I adjust people's feet and crack their toes and crack their bones in their feet, because you say, well, it's my neck, but see, you're walking on your feet. And if you're not walking correctly, or if that knee's out of place or something like that, the two bones of the knee, then that goes all the way up, okay? And it can go also all the way down too. You can have where you've got a kink in your neck. Say, think about a person where, let's say, you're trying to go out the, back out the driveway, and you can't turn very well one way. Okay, now watch that person walk, right? For instance, okay, a person who has a kink on their neck and they can't turn, they have to actually move their whole body to look that way. That's going to affect the way you walk too. That's going to affect the way you sit. That's going to affect the way you drive, everything. And so you can have one thing go to another thing. Now, massage is you're squeezing this stuff. I'm also putting a stretch. So a lot of the clinical or the deep tissue work, I don't use oil. Why? Because I don't want to slide over the skin. I want to put a stretch on the skin. I want to literally push and put it at like a 45-degree angle. And oftentimes you work in a star pattern, because if you see that the way that the connective tissue works, let's say in the fabric of, let's say, a knitted blanket or a knitted sweater, you have the warp and the woof, okay, which is looks like a checkerboard type of pattern, which is when you're knitting, you're having stuff that goes this way and this way, latitude lines and longitude lines, okay? But when you look at what connective tissue looks like, it looks more of like multiple spider webs on top of each other. It goes in all directions like a star pattern, almost like an 8-pointed star, which is north, south, east, west, northwest, east, west. So it goes in these different directions because that's the way it holds it together. And we move in all these directions. So a lot of times when a person says, I've got a knot in my shoulder, and you can feel it feels like a grape-sized knot, and I push on it, and you hear this crunching, and then you feel this release, almost like a burning. The reason why, that's what would be called a classic trigger point. So that's one of the different types of massage therapies is what's called trigger point therapy, deep tissue trigger point therapy. Because what you're doing is, if you saw inside the muscle tissue, okay, which is when the muscle becomes tight, the muscle then, and it has blood flow that's going through that. So you have these little hoses that bring blood to a muscle and out of a muscle, because the muscle is just like you. Every tissue, every organ, your skin cells, your eyes, your bones, every tissue is just like you. It has to breathe, it has to get oxygen, and it has to exhale, which is it has to get its carbon dioxide and other waste products out. Also, every tissue is just like you, which is it has to eat and it has to poop, right? So carbon dioxide is essentially poop, but also sweat is essentially poop. Poop is poop, urine, all of these other things. Lactic acid was one of these things when people kind of feel like when they've worked out and then the next day they're really sore. Lactic acid is a waste product. It's the exhaust of a muscle. Think about a car, which is gasoline goes out, the engine runs, and you got a tailpipe, which is there's stuff that's the waste products. Every tissue is the same way, is it builds up these waste products. These waste products then go to your liver to be filtered, your kidneys to be filtered, and then eliminated through your eliminatory organs, which would be your lungs are an eliminatory organ, but because you have to exhale carbon dioxide as well as other gases. Gases are a waste product, okay? Oxygen's good, carbon dioxide is bad, okay? Then we also have urine, that's uric acid. That's an acid. And when we get gout, that is because of excess uric acid, meaning it's what's called a metabolic waste. It's poop. It's cellular poop. And if it doesn't get filtered out of your body, it builds up and it burns. And then it starts to turn into crystals. I'm getting back to this in terms of why do these things crunch inside there? They are crystals. Your body forms these crystals inside the muscle, okay? And then lactic acid, another one of these acids, which is when your body does what's called ATP and it basically uses energy, it creates exhaust. And it's also lactic acid is the breakdown of a muscle, okay? So when you work out, the reason that you build muscle is you don't add more muscle fibers. You have the same amount of muscle fibers as you started with. But what you do is you tear the muscle fibers a little bit and then it repairs itself. Now, when anything tears, let's say you tear a water balloon, it's going to gush out, right? And so let's say let's say you take an orange and you put it on the table, right? And if you don't puncture the skin, or an apple, it will just wither and wither and wither. But if you puncture its skin and then some of the juices start to come out, then it will rot, and it literally will then become like, you'll see mold grow on it, and it'll get, so that's what happens is the metabolic waste from our body's natural processes. And that includes the dying of muscle tissue, because everything has to die and then be replaced. That's what happens when you get, let's say, that little nodule in there that crunches, is because these waste products, which is called lactic acid and other metabolites, metabolic waste, because they don't get filtered out in the bloodstream and because the muscle's tight, it tends to just conglomerate. So what your muscles do is essentially sweeps it under the rug and just puts it in a place, right? But when it's sitting there, it causes pain. It causes dysfunction, meaning the muscle doesn't work correctly. It tightens the muscle up, so that's why you can't turn your head very well, right? So how do you fix it is you massage it. You basically squeeze it and crunch it and then push it out. You milk it out of those tissues. And that's why people say they feel a burn afterwards, because it's an acid that literally burns. That's the burning sensation of lactic acid. But then later, it feels better. Now, that's one of the reasons why when you get massage, especially deep tissue massage, heavy duty body work, you should definitely drink water afterwards, because we've now released these things. So it's like a hoarder. When you now clean out that dirty closet, now it's out in the middle of the room. And if it's dirty, stinky stuff, now it's going to be stinking up the joint. And so taking water actually flushes it out. Also, I highly recommend people do magnesium. You take some form of magnesium. I like a powder that you mix in water, because that's a muscle relaxant. If you go into the actual, how does a muscle work? A muscle's just a rubber band that shortens and lengthens. That's how it works. So to make my mouth work, as I'm talking to you, my jaw's opening up, is because some muscles are contracting, shortening up, and some muscles are elongating. And it's a combination. So to flex your bicep or flex your arm, the bicep contracts, but at the same time, the tricep, which is the muscles on the back of the arm, have to relax, okay? So what makes a muscle contract is a calcium ion. Calcium essentially makes the because it's all magnets, it's all magnetic. What makes these things shorten up, because if you zoom in on the inside of a muscle, they actually have like little fingers. They look like little hooks, which are essentially looks like Velcro. How does Velcro stick? If you look at it, you got the fuzzy end and then you got the hooky end, and that's how it connects. So a muscle, what it does is as it contracts, what you're seeing is what's called microfibrils. They go click, 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 and they shorten. They literally grab on and shorten the muscle, okay? That's what makes it contract. So it's a calcium ion that goes on, which makes the magnetic field, makes these things go click, click, because they don't actually hook in. They're not like hooks. They're not like, they're not like fish hooks, so they don't injure you. The reason they connect is because they connect magnetically, okay? So then how does a muscle release? How do those little hooks release? They let go because a magnesium ion goes in. And then that goes, that's what makes it unhook. And then that's where a muscle relaxes. So calcium is very abundant, but magnesium is very hard to get, and it's hard to store. We only store so much, and so we have to constantly replace our body with magnesium. Calcium's very easy to get, and it's all over the place. And it's stored in our bones, and actually our body will rob the calcium. That's why people, when they feel all tight and very stuck, it's because they're basically, you got enough calcium, but you don't have enough magnesium, and you will always have enough calcium because, again, it's so abundant and it's just stored in your bones. Okay, so to release a muscle chemically, you need magnesium. Potassium is another thing. I'm getting a little bit into the chemistry, but now let's get back into the mechanics of the thing, the mechanics of, like, say, how do you get that car out of the ditch? You got to have a tow truck, and it has to be physically moved. So many conditions in terms of tightness of muscles, bones out of places, joints out of places, these little nodules and stuff like that. But then we also talk about the immune system, okay? The immune system, which is how do I fight virus and bacteria? And then we also talk about rebuilding the body in terms of literally out with the bad and in with the good. Cells, how do I make new cells? If we squeeze something, so it's kind of like thinking about like massage is like laundry, right? If you go around in dirty clothes again and again and you don't wash it, you become a bum, right? You become one of those homeless people, and God love them. And that's why, laundry and showers are so important, and fresh socks and stuff like that to homeless people is just because you got to clean this stuff up. Well, imagine that in your body as you're doing stuff over and over and over again. You wash it. Now, people eat and drink, and we wash our body out with, let's say, the internally. We're talking about this internally with like water and other good nutrients. But mechanically, if you think about your body's tissue, it's just like a sponge. And the best way to do laundry is to squeeze it and wring it out and do it multiple times. And so the mechanics of actually having physical body work, massage therapy is essential. And that's why I say everybody, including your dog, or your cat, and they love massage. Horses. My sister-in-law is a chiropractor, but she's also an animal chiropractor in particular, or horse chiropractor. And when she does chiropractic, which also involves massage, because to get a joint to move, sometimes you have to loosen those muscles up. You should see how these horses react. Like they start licking and then they start neighing, and they literally will just give you kisses because it's like they feel bad. Oh, like say a dog that has been in, let's say, a shelter dog, they bite you and they are mean because they're in pain. You feed them and give them massage, and sometimes you have to put a muzzle on them so that they don't bite you because they keep trying. But you massage those dogs and you work on them. You should see what happens to an animal. Again, this is not just humans going, I like this. This is the response of a conscious being that's unable to talk to you, but it responds by saying, I feel so much better, because it cleans the body out, but it also stimulates the healing response. It stimulates the growth, okay? You got a bad shoulder, meaning a person that says, the doctors say I need to have surgery, but I don't want to have surgery. Could you save it? Yes, I've saved so many shoulders from surgery. Or a person that says, I have had surgery and it's taken a long time to recover. How do we speed the recovery process up? You massage it, you squeeze it, you move it, you pet it, you move the tissue, and that increases the body's ability to exchange the old tissues and repair it with new tissues. You got a person that's starting to feel sick. I've worked in hospitals. I've worked in hospitals fully gowned up in face mask and everything like that. People in cancer wards and things like that. And again, some of these people, there are some contraindications, which is, again, you don't necessarily want to massage a person that has a cancerous tumor because it can speed that growth up. But this was palliative care, which is these are people that were going to die anyways, and they just needed to feel better. And one of my clinicals is I actually worked in the Mott's Children's Hospital in Ann Arbor, and I didn't work on the children as much as I worked on the parents of children. And these were parents that would literally be there for weeks at a time when their kids were getting treatment for cancer. And these parents had to sleep on couches and chairs, and they would break down crying on my table, or I had a massage chair, and they'd be like, oh my God, thank you. Like nobody's paid attention to me, and I couldn't receive it. And they finally had, even if it was just 15 minutes of where they could just let it all go, and they felt so much better, okay? So yes, everybody can respond by massage therapy. Now, what types of massage therapy? There's, again, like I said, there's a laundry list as long as your arm. Like one of the techniques that I do is what's called Ashiatsu. So I've been trained in Zen Shiatsu, which is a Japanese technique, which is this finger pressure, but it also involves putting people on a mat instead of on the table. I have like a futon mat, and you're on the floor. If you go to my website, you can see pictures of it, and I'm picking people up and stretching them and moving them around. There's another technique which is called Ashiatsu, which is there's bars, and so which is very similar to, like, say, Thai massage, which is I stand on people. I'm not going to crush you, I'm not going to break you, I don't put my full weight, but I'm using my whole body in terms of, again, you'll see like to stretch a person's leg behind their back and twist them up, and again, that's not for everybody, but everything from all these different table techniques, the deep connective tissue massage of what's called myofascial release, which is releasing that connective tissue that surrounds the muscles, because again, the muscle, if the muscle is tight, but if it's the skin that's around it, the connective tissue that's tight, you can release the muscle all you want and it's not going to go anywhere because you can't. But see, when you do certain techniques. So for instance, let's say a shiatsu massage, or I'm sorry, not shiatsu, but like a Swedish massage using oil. If your predominant pain and dysfunction is coming from your connective tissue, that's not going to really help you. It may temporarily make you feel a little better, but it'll come right back. The deep techniques of actually putting a stretch on the skin, and instead of taking 3 seconds to go from your low back up to the top, I'm going to take 1.5 minutes to 3 minutes, very slow and stretching this connective tissue. And it's basically, think about like if you take a wool sweater and you wash it, you go, oh my God, I ruined that sweater. You have a sweater that's extra large, now it turns into like a little tiny one. Well, you could fix that if you just spent time stretching it and stretching it and stretching it, and not stretching it one way, but all these different directions. Eventually you could get that thing to go back to its original size. And that's what I do, is all these deep techniques. One of the other techniques is what's called Cranial Sacral, which is, it's not actually very deep. In fact, a lot of times I'm just sitting there with my hands at the back of your neck, right at the base of your skull, and sometimes I'll put one hand there at the back of your skull and one hand at your sacrum, which is very in your low back, almost like right where the butt crack is, a little bit higher than that. And you put one hand here and one hand here, and what you feel is literally the skull expands. You can feel it get better. See, again, the sutures of your skull is like the little, when a baby is born, they got that little soft spot, and then eventually it grows together. If you look at a skull, it fits together like a zipper, and these are what's called sutures. Now, these sutures are never supposed to be solidly connected and unmovable. They're always supposed to expand and contract. Like when you go across some bridges, you'll see that they have these little zip because they're supposed to expand and contract because of the different weights on this. So now what makes it expand is actually the cerebral spinal fluid, which is your brain is bathed in this fluid. Your brain is kind of like a little embryo baby floating in this fluid. This is kind of like the amniotic fluid, but this is called the cerebral spinal fluid, okay? It's cerebral, but spinal or cranial sacral, meaning if you saw what it really looked like is your head looks like an upside down bottle of pop, which is the big end is here, and then your spinal cord, that fluid continues and it goes all the way down to your sacrum, which is your sacrum is that bone that's deep in the pelvis, that's in that butt crack, that literally kind of looks like almost like a scorpion tail. Now, that fluid is all connected, and our heart pumps, and you can see people's heart pumps, but also the cranial sacral pumps, and there's a normal pumping action. And so when people are healthy, your head expands and then it shrinks, and then that fluid then goes down your spinal cord, and then your pelvis expands or your sacrum expands. And so it goes back and forth like a tag team to this opens and this closes. And the reason is because it's like the tide, which is the cerebral spinal fluid bathed your whole nervous system. That's another big thing of what massage therapy is for your nervous system. Now, this cranial sacral is because sometimes people can get a subluxation, which is they got a bone out of place, and then the fluid gets stuck and it can't go there. And so sometimes it gets stuck in the head. So many times people that have really bad headaches, especially let's say migraine headaches, it's because and they say, I feel like I got a pressure in my head. It's because the fluid is stuck in the head and it's pressurized. And so again, it can be moved out, and like milking it back and forth, I can move the fluid out of your skull and down into your sacrum and out of your sacrum and back. And you can establish and basically get the tide to go back and forth and get you back to normalcy, that's how it's supposed to be. Because when that fluid moves back and forth, that fluid's under pressure, and there's many times when I do cranial sacral and when I get what's called the still point, which is when you can get the body where instead of it going back and forth, I can get it to even out. And that's what your vertebrae are surrounded by, or it's inside of the middle of your vertebrae. So you can have people that have like subluxations, which is your vertebrae. My back's out of place. And you think, well, I need to go to a chiropractor. Sometimes the cranial sacral will actually, you'll hear it when I get, and people's backs will go pop, 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 and it will crack because essentially like inflate, like hydraulics. This is a hydraulic fluid, like a crane. It doesn't use pulleys. What it does is it uses these oil that's under pressure in a piston, and that moves stuff. So you can actually get that fluid to go to where these pinch points are, and it will then move the vertebrae to where it's supposed to go by increasing the pressure right there, and then it equalizes the pressure, and now it's able to go back and forth. So that's cranial sacral therapy. And even though it's very, very powerful, it's actually a very light technique. And a lot of times I'm just kind of sitting there for, let's say, a good 10 to 20 minutes just with my hands there. And I can actually move. It's very subtle. But again, you can literally change the shape of a person's skull. You'll see people that have dents and stuff like that on their head because of where the sutures are stuck. And then you can get that fluid to push back, and then the dents come out. And it's amazing. It moves bones. And again, so people kind of go, well, what type should I have? I will assess you, and I'll give you what you want, what you're asking for. But sometimes I'll also do what I know and help you. And everyone says always, wow, you really know what you're doing. And I thought that that's what I wanted, but then you started doing this type of stuff. I also combine with my massage therapy, which is called kinesiology, that's the study of measuring muscles, and what's called advanced kinesiology, which is I don't have to guess where your problem is, and I don't have to guess if it worked or didn't. I can test, and the testing is your nervous system will tell me. So it's like a lot of times I like to say the muscle testing or the advanced kinesiology is very much like a modern car. If you have an old Model T, how do you figure out what's wrong with it? You just start pulling parts off. Well, modern cars are integrated with circuitry, and you plug the computer into it. And again, they'll find codes. So muscle testing is a way of asking your body's nervous system, is this where your problem is? And if I do this, will this fix it? And so I can combine that when I'm working on you. And so sometimes I'll stop and I'll say, okay, hold this muscle strong. Hold your leg like this. Hold your arm like this, okay? And if it goes weak, so a good example is like a lot of people that have really bad backs, or let's say they have a herniated disc or bulging disc at their low back, right? Lay you on your back and then have you lay on that table and then lift your leg up, straight up. Point your toe and lift your leg straight up. And then I push down on it. And a lot of times with a person with a back going, I don't know what's wrong, what I'll do is I'll push down on that leg and it'll go weak, meaning sometimes people can't even lift that leg up, right? And they go, what do you do about it? I don't know what to do. What I can do is lay you on the table, and then I will then push on either in the back of a specific vertebrae, meaning to turn it on. Or sometimes you have to turn another thing off, because sometimes it's not that something's not working hard enough, it's that something opposing it is working too hard. So what you'll see is I can target where it's coming from, and you will see immediately, whoa, wow, like the power comes back. Like I couldn't do that, or I had no strength in that. Then I do this, or sometimes I can have a person touch themselves and basically, okay, take 2 fingers and push on that vertebrae. And then suddenly you'll see that leg strength comes back, and they'll go, wow, that's like magic, that's amazing. No, what it's doing is it's like testing, like again, circuit breaker testing, and it's telling you where it's coming from. And then what you'll find is let's say that weak leg doesn't work. It comes from the opposite, let's say butt cheek, okay? Because that muscle is stuck in a spasm. So rather than just massaging the weak one, what I do is we'll work on and stretch and release the opposite one. And then now the leg strength comes back. And then conversely, the pain goes away and the function. Then people get up off the table because a lot of times we have low back problems. People don't know that they're limping. People don't know that they're not walking correctly. People don't know, they've never looked at their feet. They've never looked at themselves in the mirror, and you can see one ankle goes in, one falls in. You can see it on how so a lot of times I assess people, especially with low back issues, even neck issues, and go, let me look at your shoes. And you can see a person wears a shoe, especially older shoes, like this one's worn at the heel, right here on that side. And it shows that you're walking on the side of your foot. And if you're walking on the side of the foot, then the whole chain going all up from your ankle to your knee, to your hip, to your shoulder, to your neck, it's off. And so a lot of times people go, I want you to fix my neck pain. Why are you working on my ankle? Why are you working on my foot bones? Because that's where it comes from. And when I show it to a person and I test them and also show them their shoe and then work on them, and many times it takes multiple sessions, then they kind of go, wow, like my neck is so much better and now I can turn my head and everything. And you worked a little bit, but mostly you worked on my foot. Mostly you worked on my knee. It's all connected, okay? So again, this is Jason Eagle, your Natural Health Authority, LMT, licensed massage therapist with so many tools in my toolkit. I've got all of these different techniques that I do, and I match them up with what your condition is, what you came in for, what you're complaining about, how do I fix it? This is, a lot of people in the Detroit area, especially that work out at JC Jones Boot Camp, which is a this boot camp in Detroit, and basically they do CrossFit and type of thing. I work with a lot of CrossFit people. They call me the fix-it man. I'm the fix-it shop, and I get a lot of referrals from these people. And JC Jones will tell people, he said, go to Jason, he'll fix you right away. When I first met JC Jones, he was having a problem with his shoulder. I laid him against the wall, popped literally his clavicle back in place, and within seconds, the problem that he was having for months went away because his clavicle was out of place, and it was totally creating a whole pain syndrome going down that arm. And from then on, we had this great romance of me working on him. He's a big guy, really super strong. I've worked on a lot of professional athletes. I've had people that literally tried to fly me over the country, all over the place, to follow them, to help them, because I'm that good. I've had people like, again, one of the world's strongest guys, this guy that was, he does kettlebell competitions, and he's a huge, big, massive guy. And I'm literally standing on, I bought a special table for that guy. This guy actually bought this really souped up table because it needed the pressure of him plus me. And I'm standing on the table picking this guy up, literally picking his back up and putting his back in between my legs and arching him on the back. And he goes, wow, like I didn't know you were that strong. Like I'm strong, but you're really strong. Because I've got that deep strength in terms of I've got strong hands, I've got strong forearms, but I got a really strong back, strong legs. I know how to use leverage. I know how to use my body like a jiu-jitsu. I know how to, like a sumo wrestler, I know how to use, so I'm much stronger than I look. And again, I also know how to position people. A lot of times people say he twists me up on the table like a pretzel, right? Now, again, you're always draped. You're always going to have, you're never going to have any of, too much skin exposed and everything like that. I do a technique that's called like a diapering technique. So I can twist a person. You can come in with just your underwear on. Usually that's what I, to get on the skin is I have people get underneath the top sheet and you're always covered up. But let's say I'm going to twist your low back and stuff like that. By wrapping the sheet around you, it's like a diaper. And so I'm able to expose that leg all the way up to the groin without exposing any type of private areas. Because a lot of times too, people like say a leg problem. You go to a massage therapist and you got a problem in the groin. There's a muscle that goes there. There's a connective tissue. The muscle called gracilis connects right to your pelvis right there. And that's why it's important to have someone that's a clinical massage therapist, medical massage therapist, because they can go to places that other people kind of go, that's a little bit iffy. I don't want to. Well, that's where the muscles are. And I'm telling you, these people go, you've helped me so much because you've been able to, first of all, it's clinical. Second of all, I know every single part of the body inside and out because I've literally been inside and I've been working with it for such long. And I know how to move it. I know how to get deep in, and I know how to stretch it and move it and liberate it and break up scar tissue, break up these adhesions. These are the things that feel like these nuts. And when you break up adhesions in this type of stuff, it gets the bones to move back in place. It gets the joints to move back in place. So you can pop a person's knee, within seconds, or I can spend an hour with you and have it then go back into place. And that was what's most preferred, because what I did is I've loosened all of the things up, not just in that leg and the knee, but in the shoulder, in the arm, everything that is literally connected to it, but didn't seem like it was connected to it. And that's why I am the natural health authority. That's why I am an expert in bodywork. I call myself a soft tissue specialist, because I specialize in this connective tissue, soft tissue, that's every part of your body. Many times when I have people that have jaw problems, I put on a glove and I go inside your mouth and I literally massage and release these, what's called the pterygoid muscles, the cheek muscle, the jaw muscles, not on the outside. I'll do that too. So the jaw muscles and then the ones in the head. A lot of times I'll even put pressure on a person's skull and I can have these sutures pop. My wife said, like, the very first time that I put pressure on her head, there was this big pop, and I literally popped her skull. But that's because she had a suture that was stuck, and it immediately released some stuff. And she's like, wow, that was amazing. But it was a loud pop, and I didn't break her skull. Nothing broke. It was just these sutures that were stuck become unstuck, which then allowed for the neck to work better, the head to work better, the immune system to work better, the cerebral spinal fluid to flow better, that translates to every single thing in health. I also work even on the internal organs. There's this massage technique called Zablodowsky abdominal massage, which is I can get your guts to work better. I can get your liver to work better. I'm not poking super hard that you're hurting people, but again, I can move and mobilize these tissues and get your intestines to work better, get your stomach to work better, get your pancreas to work better, get your kidneys to work better. A lot of times when people have low back problems where their muscles are super tight, the reason is because their kidneys are jammed up. Literally, they've got sand or they got stones in their kidneys, and the muscles are tight around there because they're helping to squeeze those kidneys, because it's most important for you to have your kidneys working. So a lot of times it is a working on an organ to release a tissue, or working on a tissue to release an organ and get those organs to function better. I've had many times people that have had actually eye problems too, and by working on the muscles around the eye orbit, working on the muscles up in the actual mouth too, up in the hard palate, because that's another suture in there, I can get sinus problems. I've worked on people where I've actually fixed deviated septums or chronic sinus infections because the bones were stuck, because the cartilage was stuck, because the sutures in the face in terms of the way that these bones all fit together. So I can literally move bones in the skull because they're all connected to not only the muscles, but that connective tissue. So I've had people had ringing in the ears that came from the jaw placement, and we fixed the jaw and literally put the jaw right back in place, and the ringing in the ears goes out. And ringing that they've had for years, decades. Releasing the C1, which is the axis and the atlas. I've had many people that have had eye issues, which is they've reduced their prescription and in fact even gotten off of glasses because it wasn't their eyes that were causing the problem. It was because of what was going on in the neck, what was going on at the base of the skull, because that's where the nerves go. And so if that's all hitched up and your head's in the wrong place, and that is a lot of inflammation there, that's also going to affect the eyes, the ears, the nose, all of these different things. So again, many people are just astounded by what clinical medical massage can do other than just making you feel better. It can actually, again, like I say, it's the fix-it shop. Let's say a car's been crashed and, sometimes you got to take it to the frame stretcher. And, again, just because your radiator is working doesn't mean it's going straight down the road. You can see cars that have been in crashes and they're going crooked down the road. Well, that needs the frame to be, unbent and straightened out. And that's what I do, is I work throughout the whole body, and the body as a whole. It's all connected. And then you can see the difference. A lot of times I'll have a person lay down on the table and they go, okay, you think you're straight, right? And they're all crooked, and then I'll put them straight and literally make it where anyone that walks in the room go, yeah, that looks like straight. And ask the person and say, how do you feel? They go, I feel all crooked, but you're actually straight. So what feels like straight to you is actually crooked. And then after times working on them, and then multiple sessions, they lay back on the table and they lay straight because I've literally straightened their frame out, and literally now they fit better together. And that translates to every bit of health, everything about digestion, your immune system, your emotions. Many people, depression. I've had a lot of cases where there's this one case of a woman that actually went through a horrible thing with her husband. Her husband died of cancer, but suffered of cancer for years, and she was there by his side. And it had been literally probably like 8 years since her husband died, working on her shoulder, working on, I think it was leg or whatever, I don't remember. But it's what's called a somatic release, where she just started crying. And the feelings of that grief came back because she actually stored it. I think it was in the shoulders. She stored it in the tissues, and after she was done crying and we released it, she goes, it's gone. It's gone. I feel so much better. And it was literally, she was holding on to this horrible memory, not just because it happened, but because the tissues held on to the memory of it. All the tenseness that she sat there feeling it. And so she couldn't even let him go and let herself go and move on with her life until, even though she went through therapy, even though she went through counseling, even though it was years and she's over it, it's stored in her body. Now, I'm not saying everyone's going to have a bawling out on the table, but you will feel a somatic release, and you will find how you can store memories. Many times people, when they're getting a release, all of a sudden a memory about a traumatic event or something will come up, and they're like, where did that come from? I didn't even know, because you store it in the tissues. You're not just storing memory in the brain. You're storing memory, what they call muscle memory. You store it inside the body. So like a gun goes off and you see a horrible event, your shoulders go up like this. And so when your shoulders go up like this, especially when it's a traumatic event, it remembers it. And literally it brings up, like, you go back in time, and the fear hormones and all of these other bad chemicals that were associated with the trauma, which would be fear, anxiety, depression, hopelessness, all of these things. So you get people that have these, let's say, psycho-emotional type of things. Get a good massage. Get this, and you'll find that it gets places that therapy and meditation and prayer can't even get, because again, when you do all these things with the mind, those are important to do, but if you're storing it in your body, kind of like in a backpack, you got to unload that backpack. And the best way to do it is to get it touched and to get it squeezed and to get it massaged and get it cleaned out. And there, now the tissue's like, oh, wow, it's so much better, and now it's gone, and you have a better outlook on life, and you don't keep recycling and looping through these memories and looping through these emotions and looping through these things that are stuck in the body, because they are literally stuck in the tissues. So I can go on and on about what massage does. So if you are in some other part of the country, go find a good massage therapist. And again, if it's just, let's say, a fluffy buffy massage, you know, like a Swedish massage where they use it, go do that too. But again, don't be afraid to tell people to go deeper if you need to go deeper. Don't be afraid to start experimenting with other techniques. Start finding people in your country, or come to see me. I'm here in Michigan. Again, you can go to my website, strategichealing.us, and you can tell me what you want, but I can tell you what you need. And I can actually tell you what your body says you need. And I'll take you through it, and you will be better. And that's one of the things, is that, you know, some drugs, some other therapies, some herbs, some work for some and some work for don't. You don't know. Massage therapy, moving the body, works for everybody. Now, again, it's not a panacea. It's not going to cure cancer. It's not going to do all this other stuff. It's not. So I'm not saying that you know, again, I'm doing or putting in false hope into people, but it will make you feel better. It will make your body operate better. It will make your blood flow work better. It will make your lymphatic flow. It will make your nervous system. It will make you feel better, and it will make you be better. And that's a guarantee, because again, you know, what cleans clothes? Doing the laundry. If you do the laundry, it will get clean and it will actually be better to wear. So if you don't feel good in your skin, like you don't feel good in that outfit, you can always get massage. And just try any type of massage and keep doing it. People that get regular massage are the healthiest people in the world. They really are. People that get regular body work. Massage is one form of body work, and there's all different types of massage. But again, cars that are maintained will last forever. Cars that are massaged, right, where you change the things, you change the oil, you do this, rotate the tires and stuff like that, it will last forever. And that's a guarantee. So that's one of the things. And again, it's the oldest thing, and it will be the thing that's around. Forget about what technique or what technology you have. You can have two people with barely any clothes on out in the middle of a jungle with nothing else, and one person can massage another person. You can massage yourself. And you can rub up against a tree. You'll often see me like a bear rubbing my back against it. Because people ask me, who works on you? I have some people that work on me, but I work on myself. I do my stretches. I roll on my foam roller. I do a lot of stuff. And I need to get a massage. It's time for me to get a massage, and I'm going to go get a massage, and I'm going to have some people work on me. And so don't neglect it. Get some touch, get some body work, and it will help. I guarantee you. Jason Eagle, your natural health authority, licensed medical massage therapist. Until next time, thank you. Bye-bye.